Hello, everyone. My name is Dr. Fergal Armstrong, and welcome to Cracking Addiction. And today we have Mr. Jonathan Hunt-Glassman, the CEO of OR Health, with us, and we're going to be discussing the management of alcohol use disorder. Jonathan, thanks for coming on the show again. I want to thank you for your expertise and also your bravery, because the last time we spoke, you gave us your personal story of recovery, and I suppose that's given you a unique insight into how to help others. So, the alcohol use disorders requires a multi-pronged intervention, and there's a role for medication, there's for interventions, talking therapies. There's also a role for the digital space. So I was hoping we could go through each of those elements. How, in terms of medication, what's your view on the way to choose the right medication for someone?
The great news is we do have several options available in terms of safe, effective prescription medication that can help people cut back on how much they drink or quit entirely. The right way to find the right medication is to work with a healthcare professional. These medications are not more complex to prescribe than things like antidepressants or anti-anxiety medications that are prescribed every day in a variety of care settings, but they are dramatically underutilized. In the United States, which is the market I'm most familiar with, about 2% of people with alcohol use disorder are prescribed any medication to help them drink less or to quit. A healthcare professional will likely look to their own clinical experience and clinical guidelines written by experts. And what those typically recommend is the frontline medications, and what one is most likely to be prescribed are medications called naltrexone and acamprosate.
But that doesn't work for everyone, though, does it? It's
that is the reality.
I mean, you said quite correctly it's first line, but for some people, first line treatment doesn't work. And what's after first line?
Yeah, you're quite right about that. I don't think anything we're going to talk about, medication or otherwise today, is a silver bullet. This is a challenging problem to solve. So beyond the front line, there are a variety of medications that have some level of support for them. So these include things like disulfiram, which creates a negative response anytime anyone drinks, makes you sick to your stomach. So is appropriate for folks who are pursuing a goal of abstinence and have high motivation to taking the medication regularly. And there are other medications like topiramate, gabapentin, and increasingly evidence supporting the use of GLP-1s, which we know best as diabetes or obesity treatments, but certainly have impressive anecdotal reports around their effect on alcohol consumption and other vices, even if we don't yet have the full-scale clinical trials or the FDA and other global bodies approve indication for alcohol use. So there's a medium-sized toolkit when it comes to medication.
There is. And I mean, when I think about the medication options for patients, I think really that acamprosate, naltrexone, it's certainly in Australia, they've got the license for the approvals for the management of alcohol use disorders, but a lot of these other medications that you mentioned, and also I would add to that list that you gave, baclofen. These medications started life out for the management of diseases other than alcohol use disorder, and then they anecdotally or coincidentally people find benefit in alcohol use disorder, so they are usually indicated for something else. But it's not, as you say, there is a moderately sized pharmacological toolkit, and some of these medications are more appropriate for abstinence, as you've mentioned, disulfiram, whereas other medication are more appropriate for what I would term controlled drinking. Now, how would you describe that? What's your view of controlled drinking?
Yeah, so I am a big believer that moderation or controlled drinking is an appropriate goal for some people. Um, the evidence seems to indicate that the healthiest level of alcohol consumption for any of us is zero. And
Yeah.
there are folks who will find that abstinence or sobriety is a more practical goal for themselves. But there are also people who aren't interested in that goal and can experience significant benefits in health and well-being from reducing alcohol use. One of the doctors that we work with at Or Health likes to say that the harms from alcohol tend to have a fairly linear relationship with the amount consumed. So if someone can move from way too many drinks a week to something closer to national health guidelines, they're going to see a lot of improvement in their life.
Yeah. Yeah. So I think really the key message here is that you don't have to contemplate abstinence to access treatment or to be in treatment. And the need to contemplate abstinence, I think, certainly in my experience, has been a barrier for some people. So, let's do away with that myth. I'm very pleased to hear that you actually support that view.
Yeah, it's been my personal experience in that moderation was my goal. It's also what we see in our membership at Or Health among the 35,000 people that we've served is between 60 and 70% join and begin taking medication with a goal of moderation. Some of them will graduate to a goal of sobriety over time, either because they're losing interest in alcohol or they're finding moderation to be too slippery of a goal and they'd prefer a clear goal. But I think that the biggest problem we face in our field is not too many people pursuing goal A and not enough pursuing goal B. It's that we don't get 90% of people with a problem into treatment at all. And if we insist on abstinence as the only legitimate goal, that is going to be a barrier to seeking treatment, to staying with treatment, and therefore self-defeating.
Yeah, absolutely. I agree with that totally. But medication is not the only answer, is it? There is another arm to this battle, as it were, and that's talking therapy. So, what's your view on talking therapy, and how do you provide that within your organization?
There's no doubt that therapy can be effective on its own, in combination with medication. In my own experience, they were a great complement, going at the biology of alcohol's self-reinforcing effect at the same time that therapy was helpful in recasting harmful thought patterns that primed me to drink too much. At Or Health, we're mainly focused on the medication component at this time, making access to frontline medication to drink less or quit as easy as possible. But we support and try to point our members in the right direction in terms of seeking out therapy, either through a similar digital solution or in person, which I kind of have a bit of a personal preference for in their communities.
Now, that's interesting you say that because there are some people that for whom the thought of actually going outside is too much. And then to actually go outside and visit a clinical office and then say, I have a problem, I need help, that's just way too much. So, I mean, I suppose, first of all, what is Or Health? Can you explain that to us? And then I think we need to talk about the role of digital technologies in breaking down the barriers to accessing healthcare. So, first of all, what is Or Health? You are the CEO of this organization. Tell us about it.
Or Health is a private, convenient place to get access to medication that can help people drink less or quit. So people can learn about AUD and MAT, which are not exactly household acronyms. And then if that feels like it
What's the
might be
IT?
helpful to them,
Sorry.
medication assisted treatment.
Thank you.
At least in the US, that's the term of art. Um, and if those seem interesting, folks can consult with a clinician a doctor or a nurse practitioner licensed in their state, and get a treatment plan that is likely to include recommendations for psychosocial support, potentially including therapy, and where appropriate, a prescription for medication. And then we at Or Health, through our partner pharmacies, can ship that medication directly to folks within a few days. All of this is done online within 24 hours, typically. And so we very much exist. Our thesis is very much that we need to meet people in that moment where they want to take action without putting up a lot of barriers of time or going to a different location or sitting face to face with someone and saying, I have a problem. We want to make all of those barriers as low as possible.
So you've set up a digital service that has reduced barriers to access and care. How do you see digital technology is impacting the delivery of healthcare in this treatment space in general, not just within your organization, but in general?
I think we and the ecosystem that we're part of in this developing world of digital health bring a few benefits. One, we've talked about, which is access. Our health problems don't necessarily arise during business hours, and they are not necessarily amenable to weeks-long waiting lists. Uh, Two is more ongoing, which is the always on component. So a business that's not my own that I admire a lot is called Sunnyside. And it is a companion app where you can track how much you're drinking, get feedback, connect with coaches, and do that 24/7. That's hard to get in person healthcare. And then lastly, as you hit on, privacy and discretion are benefits. Not everybody is going to feel comfortable going into a church basement for an AA meeting, waiting in line at a retail pharmacy, or sitting in a doctor's waiting room in a way that may identify what issue they're seeking help with. All that being said, in-person healthcare is not going away. It needs to be part of the continuum of options too. I know that you are a big believer, as am I, in the importance of connection in addressing addiction. I think connection is possible digitally, but there are many of us who feel a higher level of connection when we're in person with somebody. And that needs to be on the menu too.
That's interesting. You say that you think that connection is possible digitally. I mean, there there are those that might argue that the digital space has actually contributed to a lack of social cohesion, a lack of social connection. But I suppose when I'm thinking about how I would formulate this, I think that the digital technologies are a tool that, if used to reduce barriers, actually enhance social connection. But how do you help someone who spent the last 3 to 4 years stuck at home and only communicating digitally? How can you help that individual move into the real space?
No, I agree. Not an easy problem to solve, and unfortunately, an increasingly common one over the last few years, which for some people has coincided with an increase in alcohol use and perhaps the onset of alcohol use disorder. One of the things that some of our members find is that less alcohol means more room for other things. And I think this is perhaps analogous to some forms of non-productive, harmful digital obsession. And so what some of our members find is they cut back on those spiraling cycles of usage, whatever the drug or behavior in question is, that it's so important to be saying yes to other things. Maybe it starts with a walk by yourself. Maybe it starts with going to the store and having a 20-second conversation with the cashier. Maybe the step beyond that is joining a volunteer group or a sports team. and connecting with others around an activity that you know you enjoy and that can be a source of commonality. But honestly, I think it's something most of us are working on to some degree or another, given the experience of the last half decade.
Yeah, yeah, you're right. So really, what I'm hearing is a more nuanced, balanced view of technology treatment in the treatment space. Is that if it's used as a tool for good, then it can actually help people take those first initial steps towards making the social connections, which are so vital for helping treat a use disorder. So, I mean, social connection is that amenable to the digital space? Not just within the digital space, but does digital technology help us establish it in real life?
Think the jury's out. My view is we can't let the perfect be the enemy of the good. And so if it is engaging on a message board versus social isolation, message board is preferable. Um, Hopefully, as you say, that builds social muscle, builds comfort, builds confidence, and is complementary to rather than a substitute for in-person engagement. Um, the reality is, I think we see all sorts of patterns. There are folks for whom it becomes a unhelpful substitute. So I think it's always important for us to be asking ourselves as we're engaging digitally, what is this crowding out? What's the alternative? Hopefully, it's crowding out the less helpful and less healthy behaviors and serving as a ladder or stepping stone to more and more social connection.
Now, you said in a previous podcast, you said to me that one of the key things that really broke down a barrier to treatment access was the way that you felt that the therapist was handling you. The smile, the warmth, we can work with that phrase. How do you translate that into the service that you provide for your patients?
One of the main reasons people come to Or Health is the lack of judgment. Whether that's because they've had some not so good feeling judgmental experiences in their prior attempts to seek help. Unfortunately, that happens in our healthcare system, or it's out of a fear of judgment as they describe how significant a problem alcohol has become in their life. And so, what we try to do is two things at the same time: lower barriers by not requiring an in person visit to get started with treatment, but make that digital experience one where folks know that there is a real person on the other end of their computer who cares about them and who knows their stuff in regard to medication assisted treatment of alcohol use disorder, which unfortunately, not all clinicians feel comfortable or confident treating. So it's a terrific question because it's a difficult balance to strike. But that's the aspiration. And the way we measure success is, do we get more people in the door who would not otherwise have sought treatment? And then do they feel cared once they've crossed that threshold and taken that brave step?
Yeah. So what I'm hearing, and for me, the most important thing from what I'm hearing is actually what you said. It's the lack of judgment. That's the key, isn't it?
Yeah, in fact, I think people should be, commended for screwing up the courage to seek help, whether that's connection from another individual, digital or in the real world, whether it's seeing a healthcare professional in person or online. My philosophy is we need as many approachable front doors to bona fide evidence-based treatment as possible. And different ones of those doors are going to strike the right mix of richness and convenience for different individuals.
Yeah. So one last message of hope for anyone watching. What would you say?
I'd say the barriers to getting started in the right direction are lower than ever. Digital health has made it possible to connect with individuals like you or healthcare professionals or both 24/7 from anywhere in the world. Um, Sometimes we think about recovery from addiction as requiring this massive, dramatic moment where everything changes. That's terrific if it happens, but it can also be as simple as pulling up your smartphone and finding someone who's available and ready to help. They're out there.
Jonathan Glassman, CEO of Core Health, I really want to thank you for your wisdom, and I'm sure that listeners will find what you've said inspirational. So thank you.
Thank you for having me and using your platform to help people in this way.
That's all for today, folks. My name is Dr. Fergal Armstrong, and this has been Cracking Addiction.